Hello, everyone. My name is Adam Ayers. I'm with April. I'm our technical and training service administrator, and this is our core conversation on independent living skills and training. Um, to introduce myself, my name is Adam Ayers. My pronouns are he and him, and my title is a TTAS with April. I'm a disabled man with 3 kids. Background in rec therapy and adaptive sports. Coach wheelchair basketball for the Cincinnati Dragons. And I'm really looking forward to this conversation today on the topic of independent living skills and training. So I want to kick it to my co-host today, who is Dr. Lydia Fonseca. Lydia?
Thank you, Adam. Hi, everyone. My name is Lydia Fonseca. I am the Director of Programs at a center in the South Texas area called Valley Association for Independent Living. But I am also an April board member, and I'm happy to be here today and glad to see so many people joining in on this conversation. Today, we're really just going to kind of peer-to-peer connect and talk how each of our respective centers provides IL skills training, maybe the different processes that each of our center has, look at some similarities, what's worked or what hasn't worked, and just kind of have a conversation around those topics. So I'm just going to really leave it open to everyone here. And I'm sorry, my pronouns are she, her, and ella. And if you are going to speak, I just ask that if you can turn on your video. If not, that's fine. But please identify yourself by your name, the area you're in, and pronouns if you'd like as well, just to capture that all in the transcript. And then also you're welcome to use the chat if you want to type in any of your responses or conversations. So I guess I could start off by asking if anybody'd like to share what the most common IL skill training service request is at your particular center. Is there one that is requested a lot more than others?
I start. My name is Teresa Bell. I am with Life of Mississippi. Corporate office is Jackson, Mississippi. My office is located in Tupelo, Mississippi. My pronouns is she and her. And I guess the biggest support that we give at this time, we were closed for like 2.5 years because of COVID. So we're trying to, get back on track as far as our fundraisers. We are a nonprofit, doing our fundraisers and our event, exposing ourselves again back to the community to let them know we are here and we are back open full time. And the biggest support that we give out now is mostly information and referrals. So we refer to different organizations and state organizations. I attend quite a few meetings with the city in order to make these contacts. Since we are funding of our on our own, this location particularly has no funding because of the closing. So I try to connect people where we're not able to help them in areas where we would be able to help them. I try to connect them with different organizations and different government programs and try to help them in that way. So that's our biggest area is information and referral at this time.
Oh, okay. Well, thank you for sharing that, Teresa. And I'm curious, when you guys are providing those INR services, do you identify any specific skills training that they may benefit from that either other agencies that you're referring them to are assisting with, or that your center may be able to help with?
It depends on what their need is at the time. Most of the needs are just them not knowing of certain organizations that are here, that are available. They mostly know like your basic or your common, let me not say basic, but your common, which is like your hospitals and your medical centers, but they don't know a lot of the organizations that are also nonprofits that would help them. I haven't had so much of me needing to do a skills train, but I have done a lot of having to advocate for people as far as making sure that what they come to us with a need for when we put them in contact with someone. If they don't receive an answer or don't receive the information that they're looking for, I advocate on their behalf and go a step further and try to figure out how we can work it out. So that's the level where that we are. I just started last July, so
Oh,
I'm
no,
still learning the ropes.
no, thank you for all you do. And you may not think it's an IO skills training, but the way you've identified it is really teaching people how to navigate community resources. That
Okay.
can really much be an IO skills training. So they can now know, now that you've showed them, this is how you look for this place. These are the places in your community or in our community. Next time they'll be able to probably do it on their own or try it first,
Correct.
as opposed to class. So that is an IO skills training that you're doing in terms of teaching someone how to navigate community resources. So thank you for sharing that. Yeah,
Thank you.
yeah, absolutely. Would anyone else like to follow up with that, with what their centers are doing? I see Deanna with her hand up.
Yes, I work at Independent Living of Niagara County. It's Western New York based. Basically our independent living skills that we really focus on here is housing and benefits advisement. Housing, because the housing market here is completely, to be blunt, trash. Like there's no, like people are starting to like the homeless shelters are starting to like overfill. Like people don't know how to navigate the system when it comes to Section 8 and HUD, as well as they don't know like how to apply for apartments. So like we help them with that, as well as benefits advisement. I ended up becoming a benefits advisor, and it's just basically helping people who have overpayments on their Social Security like income, basically trying to help them get that waived or at least lower the overpayment, as well as getting them on Social Security, which Social Security has been changing a lot since COVID, because they yelled at me because I sent something in through fax and they're like, no, we need a wet signature. And I'm like, okay, you didn't need to like say it like that. But yeah, those are the two big things that I see that we are having with is just housing and benefits advisement.
Yeah, so it's really like application assistance and teaching someone how to fill out those applications for those benefits, right? So that's great. And I've been hearing a lot about that across the nation, because through COVID, how people weren't able to make payments and there was that whole deferment thing. And then once it ended, the housing complexes were charging them the full amount for that year and a half or 2 years, and they couldn't make that payment. And so now when they're trying to navigate and find housing in other areas, their backgrounds are coming out with previous evictions, so they're no longer getting approved for housing. And this is just a whole mess. We're seeing a lot of that in our area too. So I get it. I get it. So I think application assistance for housing, for benefits, whatever that may be, is a critical IO skills training that needs to be done for a person. So thank you for doing that.
You're welcome.
And before I move on to the next person, I do want to kind of recognize what's going on in the chat room. So I did see that Terry Saltzman added that advocacy and self-advocacy is one of the main things that they're doing in their area. Danielle Carter mentioned independent, oh, that's her, she put in her contact information. And then Terry also put housing, transportation, and employment. Becky Clark put cooking and employment skills. Would you mind, Becky, not sure where you're at, would you mind maybe expanding on that, how cooking has been a major request and how your center goes about providing those services?
Sure. We have a lot of young folks that come and they want to learn how to be, that's one aspect of being independent. So it's a big desire to want to learn even basic things. So many people just, if they do any of their own cooking, it's microwave. So we try to do it at least every other month, have a big cooking class where we plan what we want, they get to choose what they want to cook. We will plan a menu, do comparison shopping. And then, everybody gets a turn trying to help prepare things. They get to taste things and learn how to also clean up. So, try to encompass all of those independent living skills together.
Yeah, absolutely. I think it's a major one that sometimes we don't think about how going back to like the basics is very much foundational to get to move forward in their IO plan and process, right? And I think cooking and meal preparation and all of that falls under like the home management
Correct.
category of the IO skills training, right? And so home management is definitely important to what I always call adulting 101 or IO skills training, right? And so it's
Exactly.
definitely a great thing that you guys do that. And so your center essentially already just has classes set up.
So
for
we
the-
have 3 different locations. We have the one in Austin, which we have classes set up. We have one in San Marcos that has classes. Our Williamson County is mostly virtual, so I have folks attend in with our Austin classes, or I do classes virtual with them, as well as I do one-on-one meetings with the consumers as well.
Neat. So you're able to tackle on those different approaches. You could do you do your hybrid, you offer the classes, and I'm assuming you have like a calendar set up for a certain amount of months throughout the fiscal year.
Yeah, it's basically, every month or two I send out new calendars, but we try to keep it along the same core ideas.
Right.
And we are constantly trying to get feedback from the consumers, what they want to learn.
And that was my next question. How do you go about developing the next courses? And that's really important, getting that feedback so they can
Yeah.
advance that, right? Okay,
Exactly.
awesome. Thank you. Thank
You're
you for
welcome.
sharing that.
I have a question. I can't seem to find myself on on my computer here, but in our agency here in Michigan, we do a rice cooker. We have rice cooker recipes. Do you ever try those with your consumers? Are you familiar?
I have done some. We have used a lot of different aspects, from either a microwave, we have hot plates, electric skillets, air fryers. But yeah, I'd love to see some more ideas on rice cookers. I mean,
We
that
have a
would be
whole
great.
we have a whole program that we've got based off that.
Okay.
Let me put my email in the chat box
Oh, I'd love to. Thanks.
and we can get in touch, okay?
Okay, perfect. Thanks.
Yay. It's the whole purpose of this, to connect and
Yes, I
share
love it.
ideas. Great, great. Thank you, Christina, for sharing that
You're-
and allowing that.
You're welcome.
Yeah. Would anyone else like to share? Before that, I'm sorry, let me go ahead and continue with the chat. So I do see someone here, Stowe, am I pronouncing that correctly? I hope so. From the Disability Rights and Resource Center in Virginia, put, unfortunately, IO skills is one aspect that we do not do a lot of, but we are trying hard to improve it. We're a small CIL with only 3 full-time employees, not including the director. Yeah, and that's what we see sometimes, that it's hard to be able to expand on certain programs because of the limited funding or the limited size and staff. But I'm curious, is there anyone else on this call who may have gone through something similar, or is currently going through something similar, and how they addressed it to ensure that that IO skills training is somehow being offered and provided in their community?
I can. Hi, I'm Celia Dixon. I go by she and her. I'm at the Solutions for Independent in Winston-Salem, North Carolina. And we do a variety of IL skills, but I have to say I'm on the adaptive sports route with Adam as a recreation therapist by trade. So I know. And so that's one area that we were able to pull a lot of our, IL skills together. We were really fortunate that we knew a lot of folks and had connections prior to me coming here. And so we were able to utilize the wheelchair basketball team, our Kimberly Park Tennis Association, and other municipalities with our Parks and Rec, that we were able to join with them. And so we offered no cost programs throughout the week to all of our youth and adults with whatever disability they have. So we incorporate whatever the skills that they need to work on. So a lot of with our kids are those, advocating for yourself and social, the social and cognitive aspects that you need for integrating into the community. So we're able to do that along with all the physical components. So we have, so we're able to do that really through our adaptive sports. And then we have we do a lot of INRs. We do just like everybody else. And so it is that INR turns into the IL skill training for resource management, right? And being able to coordinate the resources in the community for whatever that goal is for that person. So
Awesome. And so a quick question on the adaptive sports. In terms of like IL skills training, do you guys often have individuals who maybe are just learning how to use new adaptive equipment and then there's training on that? And so then that would
exactly.
be IL skills training too. Okay.
Yeah. Yeah. So, I mean, we can incorporate even the physical component of it, like being able to be independent with their transfers and being able to use adaptive equipment and also being able to advocate for themselves and tell somebody how they need assistance. So, and then that can play into all aspects of your life, right? With transportation and all that kind of stuff. So yeah, it's like a little string and you just keep pulling it. So I tell interns.
Yeah, it's interesting because it seems like the adaptive program you guys have really almost encompasses all the different categories of IO skills training as listed by ACL. So your personal management of how to use those transfers, right? The equipment. Beth, is you're offering them to be able to serve a population that they usually don't reach because centers do. And then you're able to then offer the service to the consumers with that partnership. And so, yeah, we've done that all the time as well. I mean, we don't want to duplicate services. We just want to partner up, collaborate, and see how we can best provide that service. And so we'll invite them to our center to do the class. And then our consumers will be able to be served there or one way or another hybrid format. So great. Great for sharing that. I see Angela Clark put home by choice. So I believe that's a relocation program, if I'm not mistaken. I don't know if Angela would like to expand on that, but I do see Genesis Taveras with her hand up. Genesis, I'm just going to go ahead and let Angela expand on that comment, and then we'll get to you next. Go ahead, Angela. Oh, you're on mute.
Hey, can you hear me now?
Yes, ma'am.
Okay, yes. I Home by Choice. It's based on community based on individual who's on Medicaid. And we offer them the choice to be independent to get back home from the nursing facility. And we also assist them with nursing services. And it's like attendant services as well as when they go back home, case management, we help them to where they'll be able to live independently at home, coming from the nursing facility.
So kind of teaching them those home management skills once they're
Yes,
back in their
yes,
community of choice.
yes.
Okay. Great, great.
And they're all, and then we also help them with their housing the system and with finding housing as far as, and then within group homes and
Yeah.
assisted living facilities, and we'll assist them with that.
Great.
And
That's a full
that
scope.
and they're all on Medicaid if they're qualified.
Okay. So
On
specific
Medicaid.
population. Okay.
Yes.
Perfect. Perfect. And also I want to give a shout out to Janice because she keeps supporting everyone with her emojis after they give the responses of what they do. So thank you for that, Janice. I'm gonna kick it back to Genesis Taveras. I'm not sure if she's still on the call, but I think the hand went down. But if you'd like to ask any questions or add to the conversation.
Absolutely. Hello, everybody. And thank you so much for providing this platform. I think this is an excellent tool. But I think that just to add on to the point that was made about reaching out to other community providers and human services providers, I believe that using the tools that managed care organizations provide. So I'm at the Center for Independent Living of Central Pennsylvania. So we work with UPMC. A lot of our consumers have UPMC, Amira Health, PA Health and Wellness are the main managed care providers in our locations, and they offer a lot of different resources. So just thinking back, there are resources that they provide for paying for somebody to go to high school if you want to, get somebody those tools. They even help with providing services for smaller children that may be living with a disability. They provide incentives for mothers and payments and things like that. But another thing that I wanted to say, just to play on some of the skills, if maybe funding is an issue, one of the things that we have done, we've done chicken fried rice as one of the things, but some of these like hot plates and things are pretty expensive. So we've kind of gotten a little creative on making meals that do not require hot tools. So we've done like overnight oats, which just require, some oatmeal, milk, whatever milk of your choice, and then some toppings. And another thing that we have on the schedule as well is to do laundry. So how do you do your laundry? Folding laundry, which is a really great idea.
Oh no, you got muted in the middle of that sentence after you said laundry.
Yeah, just laundry was the last thing I was gonna say, that we've also, been working on how we're gonna do laundry, and as well as even partnering with like safety community in your area. So police officers are a lot of times willing to come in and teach different safety skills to our community.
Back to the mute button. Teaching safety skills to your consumers.
Yeah, I'm finished already.
Oh, okay. Okay. All right. Awesome. Well, thank you for sharing that. So it sounds a lot like most of us do have cooking and meal preparation as one of the main IL training skills training requests. And then also, I know you mentioned laundry and like making bed, washing, that kind of stuff. I'm curious, do any centers here have a partnership, someone that they partner with, or maybe at their center have like an area where, so I know some of us have like a cooking skills kitchen, right? But does anyone have like maybe a bedroom or a washer dryer area where they can practice folding the sheets, doing laundry, things like that? Or do you guys usually do like home visits and then teach them how to do that in their home? How do you approach those home management IL skills training?
This is Janice Brassel. I'm at Center for Independent Living in Cincinnati, Ohio. I am the Independent Living Skills Specialist here, and I've been here a little over a year, and I've done a lot of different things when it comes to skills training. And but right now, I like to I'm listening to what people are doing around home management, because that is one area that I'm starting to get into more. We have done a lot of things like budgeting and scams training, not only for seniors, but for everyone, because we saw that was a need. A lot of that type of thing was going on. But home management, I've kind of combine a lot of things into home management. So when I'm doing it, I'm not only teaching them cooking and cleaning and laundry, but also teaching them budgeting and just organization. I mean, because I think home management kind of encompasses a lot of different things, and so we've added in the budgeting, the communication skills, and just kind of taking that and making it taking a holistic approach to home management. And then something we've been doing that kind of came out of the meeting with different consumers is we started an LGBTQ peer support, which kind of came from the consumers, that we have once a month, and it gives an opportunity for people who are LGBTQ plus, but also have disabilities, to kind of come together in a safe space to communicate and talk about things that affect them, because not only do they have a disability, but also they are LGBTQ. So that kind of came out of just from our consumers. So, we're actually right now doing an assessment to try and find out more about what people want instead of what we think they want, but trying to do an assessment to see what what do people really want? What kind of training do they really want? What kind of things do they want to see from us as a SEALs? So that went out recently, so we're kind of waiting to get that back. So that'll be interesting to finally put something out there and not just spinning your wheels, but really finding out what people want.
Yeah, well, that's amazing. Becky, did you raise your hand?
I did. I'm really excited to hear about your assessment, Janice. We ask folks, but a lot of times they get this, blank look on their face, or, oh, I just want to keep doing what we're doing. So how do you go about with this assessment now? And if you got some ideas for me.
Well, our director here, director of programs, and we have an intern here, put together this assessment that's been trying to go out for a while, but it finally went out, and it's going out to people who we have. Mostly, I believe they're mostly people that that get our newsletter. We also have a newsletter that goes out with everything that we're doing as far as training and different things that we're doing around our SEALs and around in the community in Cincinnati. But that assessment, like I said, just went out recently, but we're sending it out to people who were previous consumers, people who are consumers now, just trying to find out, what do people want? And having a chance to, once we get those back and go through those, and really having that data would be important for us moving forward, to make sure that we're meeting people's needs and we're meeting them where they are, and not just thinking of things that we think they want.
Yeah, I'm really excited about that. Thank you so much
I
for
am
that.
too. I'm glad that kind of finally came to permission, because it's something I think that I think it's something that everyone needs to eventually do, because whether you're doing it on a yearly or every other year, but at some point we need to find out what people want.
Right.
So I think that was a very good thing to do, especially when you have all these consumers, but how often do you really have that conversation with them,
right,
about what they want? So,
and like I said, a lot of times they don't really know, or know how
right,
to verbalize, and so the idea that you're able to come up with an assessment.
yes.
And so how did that come to be? What ideas did they get, and how did they create this?
Well, I didn't create it. My director of programs and my and her intern actually are the ones, because for me, as a person who does the training, and trying to come up with, and I'm probably you all struggle with the same thing, is what types of trainings should we be having? What do people really want to know how to do? And for me, I've been putting on different trainings, but also I'm wanting to know, what else do people want? And so there's a piece in this assessment that's actually asked them about what do they want to see in training? What would they like to see us do for them as far as training? So that's a piece in there for me for that. But I will reach out to her and see if she minds, if that assessment actually can be shared.
Thank you so much.
That way, if you need it, you're not inventing the wheel. It's already there.
I
So I will
think
check into that.
Thank you for sharing that, Janice, and for checking to see if that shares. But I also foresee a potential April conference presentation on the data that was collected and how that went. A call for proposals did recently go out. So
okay.
I want to share that with your director of programs. It's not until October, so I'm sure you guys will collect some data by then.
Oh yeah,
It'd
definitely.
be really great for y'all to share that. I think it would be a good presentation.
Oh, that's a great idea. I saw the proposals, asking for proposals. I saw that. Yeah, that would be great. I would definitely get with her on about that, because I would like to actually attend,
Yeah.
and to be able to present that that data would be great.
Yes.
Thanks for that idea.
Mhm.
I would like to share over at the center that I work with. I'm not sure who the program is affiliated, but we have a program that we can present, and it's called Living Well with a Disability. And the consumer sets up a goal. They find people to support you. You've how to find information, how to communicate with your doctor, eating well, exercise, how to be an advocate for yourself. Those are some of the topics this program covers. And we do, we gather up, a bunch of consumers and we do a presentation along that line. Is anyone else familiar with the Living Well with a Disability program?
This is Janice again. I'm the facilitator for our Living Well in the Community workshop. We have a 10-week workshop. I'm actually at the end of that workshop. Is that the same workshop?
Yes, I believe it is. Yep.
Okay, I am at, I have 2 weeks left, counting this week, but we did a 10-week, we did the 10-week program. We're at the end now. So it was very good. This is our second year doing it.
Yes, this is also ours, but do you remember, Janice? Because I wasn't the one that set up, one of my bosses set this up for us to start working through with people in our communities. And I don't know if there's people that were interested in getting the program brought to their area, who they would contact.
They would contact Erica Harris, and I can put her information. I can, if there's one person that I could send it to and they can send it out to everyone, but her name is Erica Harris. This program actually is funded through the Center for Disease Control, CDC. So, and I know they're always looking for SEALs to participate in this. So
you get reimbursement for participants and everything.
Yes.
So program, I have been at the teaching end. My organization, Disability Network Capital Area, and I'm in Michigan, and Capital Area responds to the Lansing, but we have 4 sites. We have Lansing, we have Eaton County, we have Shiawassee County, and Clinton County. And I run programs out in the Clinton and Shiawassee County. And then there's someone else that runs programs out in Lansing and Eaton County. So, it's a big area that my SILS covers and everything. But yeah, there's a way you can put that information in the chat for everyone else. That would be, I think that people might be interested in that. I just don't have the information. I'm not the head honcho that runs that program.
Okay. Well, I see that someone, Cynthia has put out the link for Living Well, but I can go out and get Erica's information.
I just put my email on the chat, Janice. If you don't mind sending that to me, I can get it to April and then they can distribute it to everyone.
Okay,
there we go.
Okay.
Thank you.
I can do that. Yes.
Yeah. Great. Awesome. Okay, would anyone else like to start a conversation on the IL skills training that is happening? I did see a lot of conversation going on in the chat about when we were talking about home management that someone did mention that they do have a washer and dryer, I guess, in their facility. I'm trying to go back and find that to do that training. Let me see. Yes, so Amy Klein, but we have a washer and dryer here at the center, the SIL NCP in our building, but we prefer to meet the individual where they are so they learn the equipment that we'll be using. Absolutely. And how often do you use that at your facility? And do you usually have like classes, so multiple people learning at the same time, or is it usually individual when you do use the equipment in your facility, Amy?
Hi, yeah, we usually just use it individually. We do have an activity calendar where we can do monthly group type things like that. But for something like that, it's more beneficial to be one-on-one.
Yeah, and so when you're conducting, and this is for anyone, when y'all are conducting those one-on-one home management skills training, at what point do you identify? Is it during observation? Do you guys have a specific intake process where maybe certain adaptive equipment may be needed to complete the task or an adaptive way of doing things? When is that identified, and how does your center go about that process to ensure that they have the right type of accommodation or adaptive equipment to be able to complete that task? And I don't know, Amy, if you could chime in on when you do the one-on-one in their home, does it usually come up that they need to do it in a different kind of way to complete the task?
I'm trying to think.
Because, that'll involve a lot of different types of individualized skills training, right? Depending on the person.
Right. I mean, we do have an assistive technology department here too, so we are always looking at those types of things when we're doing anything really.
Yeah.
Of
So you
how
can-
assistive technology can help, right?
Great. And are there any other centers that may not have maybe like a assistive technology department or lab in their center that they have to partner, or who would they partner with to be able to get those resources to complete their IELTS skills training? I didn't realize I could click on the arrow and there's a whole set of other people on the call. Awesome. There's a lot of us on here. I'm gonna go back to the chat to make sure we get everyone who sent in responses. We also have Brandy Maccabee. We recently purchased Life Skills Reimagined online curriculum and plan on coaching consumers through that. This will save staff time and help us measure knowledgeable gains and increase confidence of living independently. And then she added the link on there. And thank you for sharing that, Brandy. Have y'all, I know you said you recently purchased it. Have you started with any consumers yet? And how has that gone? Or how do you plan on doing that?
Hi, I'm Brandy McCabe. In response to Lydia's question about Life Skills Reimagined, we literally just purchased it, and we have not had any consumers go through. I have had experience with the curriculum before in a previous role that I had, and we did find a lot of success in working with specifically the population that I was working with was youth and young adults in transition from foster care. So it was just very well received, and it was very accessible. And I think the way it's designed is one that most people would benefit from, because of the way that it's, there's actually, it's rooted in learning science, and it is evidence informed, and that's something that they're continuing to work on. So I would recommend anyone to go and maybe do a demonstration or see a demonstration of it and learn more about it. But we're really excited, and I can report out at another time how things are going, specifically working at a center for independent living and in those consumers.
Yes, thank you. Thank you for sharing that, Brandy. We actually have a similar platform. It's called My Full Life, and it's an online curriculum too. But what we've realized is that it's more tailored, or youth transition age youth are the ones that probably benefit the best from that online curriculum, as opposed to when we're working with adults. And that's probably many different factors. Age differences, right? But I think because it was designed more for like a school setting for the youth transition department. So I think that's why it's a lot more like school based. I'm not sure how the Life Skills Reimagined is designed is it like a portal where they can go in and do their thing and then you look at the data, how they've completed it, or?
Yeah, like there's a learning management system.
Okay.
And so they do get video. There's knowledge checks built in. There is some exercises, so there's actual, written plans, activities that would be best facilitated by a staff member or coach. And although that a lot of these things like, personal finance and resiliency, things are often, I think, having worked with youth in transition, those were definitely, right up their alley, maybe their first introduction into the budgeting basics or something. But I think what I've realized in working with, specifically in more of my history is in child welfare, but there's an assumption sometimes that because people are adults that they have this knowledge or that they're applying the knowledge. And we know from the trauma brain that, often we learn things and we forget things quickly. And so at our Center for Independent Living, we were working a lot with people experiencing homelessness. Also, they have, disabilities. However, again, taking it for granted that those core things were at some point taught, and that they've learned them, when in fact, the curriculum is really about, addressing the, critical life skills needed to prevent homelessness. So, yeah.
So it does a lot of your IELTS skills training, but then it kind of dives in a little bit into like diversion to like prevent them from being in an institution or things like that. So it tackles that on. Awesome. Well,
Absolutely. Absolutely.
That is amazing. Thank you for sharing that. Does anyone else use a learning management system for their skills training? I got just a quick follow-up. One of the things that we realized when we started implementing that was that before they can even get started on an online system, they needed computer skills training. So individualized computer skills training, that kind of stuff. And everybody had a different kind of thing. And then we've identified some gaps where maybe someone needed access to technology or access to connectivity in their homes. And then they live in rural areas. So it was just like trickling effect. And so having that holistic approach, I think that we were talking about earlier was really important and came up when implementing this new thing. And I'm sure you guys have probably seen that or will see that once you start implementing it as well. So I'm curious and excited to kind of do a follow-up with you, Brandy, and see how that's going to work out for your center.
Absolutely. Yeah. Look, feel free to reach out and at any point in time. I love that there's a mobile app. And again, ideally we would have facilitators, really coaching them through, but it's something as simple as sharing login information, and they are empowered to be educated in, so many of the areas that they may, whether they know it or not.
Yeah.
Need more education around. Yeah.
Great. Thank you. Okay, so after Brandy's response, we have Cynthia, who said, yes, we do it here. Wonderful program. I'm assuming, Cynthia, that was when they were talking about the Living Well with a Disability program, because you, I think, put the link right after that. And then we shared the information. It's going to be emailed for Erica Harris. And I believe, Adam, you added a link on the chat, correct?
Yeah, I added a link to our survey that you can feel free to take now or at the conclusion of the meeting. And we'll also send out an email with lots of the information from the chat and any information that people requested. We'll get that out to you hopefully by the end of the week. So thank you.
No, thank you. I'm going to go back a little bit on the chat because I did, I think I skipped some, and I do see Tally or Kai, I'm not sure if I'm pronouncing that correctly. They mentioned the TREES or TREES program. It's about relationships, boundaries, and consent. Would you like to expand a little bit on that? And how that's incorporated in your IELTS skills training? Let's see, where are they? I do see that you unmuted, but I'm not hearing anything. Okay, if you'd like, you can add it to the chat. I'm not sure if there's something happening with the audio, or if is it just me? Can anyone else hear them? Oh, I see. Not sure you can add it. Yeah. So in terms of your IELTS skills training, through that program, how often do you have it? How does your center go about providing that service? Is it something that is scheduled and you have like a calendar that you put out and people join? Or do you do that individually with one-on-one with consumers, or both? And while they're adding that to the chat, does anyone have any other kind of out of the box? Becky.
Hi, thank you. So we collaborate with Safe Austin as well, that will come in to all three of our, well, both virtually and our San Marcos and our Austin office, and help facilitate that same type lesson on safe relationships, consent, knowing what your emotions are and that it's okay to have emotions, because many times we are told that, you know, we can't express our feelings. And it goes into internet safety and further, you know, and they have been so great to come and work with our folks. So, and then we will next year be working on train the trainers, so they will help us to be able to, for new consumers, to be able to continue on these lessons.
That's amazing. Not often do centers or agencies have the opportunity to get train the trainer programs, and I think that's the best way to continue and sustain programs for centers. So that's really neat that you guys have that opportunity. I do see that Sierra Allen added to the chat. Hi, my name is Sierra Allen, and I'm the Disability Services Specialist with Reach Inc. in Plano, Texas. Just wanted to know how I can go about getting a curriculum for ILS training. So I'm going to add a link to the chat. It's snapcurriculum.org. That is curriculum that you can order, and it's specific to individuals with developmental disabilities, but it can be modified for other types of disabilities as well. But that is actual curriculum that will be mailed to you that you can use in your facility or when you're providing one-on-one services. If you would like the online ones, I can go ahead and resubmit those on the chat for you, Sierra. That is one, and the other one was Life Skills Reimagined. And then there are other curriculums that are disability focused. So it just really depends on what your center is looking for, but you welcome to. I don't know if anyone else would like to share any specific curriculum that maybe your center has come up with and developed, maybe patented, because one of the things that we'd love to do is to support our fellow SILs in terms of curriculum and things like that, as opposed to getting outside agencies, right, to do that. So does anyone else know of any specific curriculum for IELTS skills training that your center may have developed already? And I do see that Kali, I hope I'm pronouncing that correctly, her response that it's in a case-by-case basis. We partner with our local Department of Vocational Rehab for referrals for this program. And the acronym stands for Teaching Relationships for Everyone in Everyday Situations. So is this considered more like pre-vocational services, like work readiness services before they go out and learn vocational training? Which is why you work with your VR? Oh my goodness. Time is just going by so fast. We're having this great conversation. We have just a few minutes. And Kai, you're welcome to put that in the chat. Yes, I sure can be. Otherwise, it's for transitional ages of 17 plus. Thank you for that. I appreciate it. anyone else on the call that has burning questions, maybe they want to start a new IELTS skills training, or there's something in the categories that is directed to IELTS skills training that maybe they haven't really tackled on, and they'd like to learn how they can maybe create a program at their center that'll be able to fulfill that category. And I'm actually going to, and this is, I'm going to put in the chat when I mean categories, that when we're talking about individual independent living skills training, I'm sorry, we're talking about either personal management, home management, communication, information access, and technology, and the different things that can fall within those categories. Please let us know. This is the time and the space to see how we can develop programs or how we can improve our programs, or if we have questions because we're having barriers, we can connect with our peers and converse on how we can improve on that. I do see in the chat, there's a question that says, does anyone have or know of a nutritional skills training for people with disabilities? Bonus points if functional foods are involved. So maybe those who have those cooking workshops at their center, do you maybe have a focus topics, like maybe diabetes friendly menus or ways to teach, right? Or anything related to disability specific, or their type of restrictions or food restrictions that they may need due to their disability. Has anyone ever come across having to develop a curriculum like that, or partner with an agency that could teach something like that? So Celia Dixon mentions, I use Casey, maybe, life skills assessment. Is there another IELTS skills assessment that anyone uses that they have found beneficial? So this is a general life skills like intake that you're talking about, right? Okay. And where did you guys get that from? Do you know, is that maybe evidence-based? Is it from another center?
Yeah, it's evidence-based. I actually got it from one of my OT friends.
Okay.
So yeah, I had a student here that we were working with. She's a OT intern. And so we were looking at something. We were looking at doing the pre-ETS program and bringing that to Forsyth County schools. And so we were looking at a specific assessment. And that's the one that I found that was most, I mean, it was, I want to say non-therapy related, but it was, it was one of the easier ones I think that everybody could learn as far as how to do the assessment. So that's just the one that we picked, but it's, we got it off the internet.
I'm going to put the link, I believe is the one of what you're mentioning.
Yep.
So it assesses daily living and self-care activities, maintaining healthy relationships, work study habits, all the good stuff, all the IELTS trainings that we need, right?
And it's easy to score.
Yeah. Also, it has a scoring guide too. Yeah, that would definitely be something that would be useful, I think. I think some centers, I think we have a wide variety of ways that our centers do things. Some centers just have their general intake form and ask the question, and then whatever responses they get from their consumers, that's how they go about developing the ILP with them. But then maybe there's consumers like Becky Clark mentioned earlier, where they just don't know, right? That they can't just respond real time. So it's more of maybe observational skills that you do when you're doing an assessment. So this is pretty cool. Brandy also added Life Skills Reimagined has a built-in assessment tool for each of the 5 topic areas. This can be done pre and post program to help with independent living planning and to see improvement. This is really cool. You're covering everything that we need, Brandy. Thank you for sharing this. This is an amazing resource. Thank you.
Lydia, this is Joan with April. We also do workshops with Kelly's Kitchen and the Color Coded Chef. And they also, when their recipes, when they're doing them, give little suggestions if there is food allergies, if there's something that somebody just doesn't like in it. So we're just finishing up a series on that, but we'll be running them again. But also you can always go to Kelly's Kitchen and the Color Coded Chef's websites, and they specifically do things for people with disabilities. So it's a really fun thing as well.
Thank you for sharing that. I'm gonna try to get the link to Kelly's Kitchen. And put it on the chat, but I want to make sure that I do the right one. Or I don't know if Adam or you, Joan, or Alyssa could provide that resource. I just want to make sure that.
Yeah, I'm definitely going to save the chat and I'll send
Okay.
that out with
Okay.
the video once we kind of collect all of the resources that we talked about that we wanted to share. So I'll get that out as well with the chat.
Okay, perfect. Thank you, Joan, for adding that. Just want to make sure I didn't put anything incorrectly in there. Oh my goodness, we have 2 minutes left. Anything else y'all want to kind of talk about before we, because this is not going to happen until next month?
Mm-hmm.
Yeah, we have the space right now, the time.
Hi, this is Janine speaking.
Go ahead.
My resource is Michigan specific, but we have partnered with Michigan State University Extension to talk about healthy eating, nutrition, proper food storage, and food safety.
Thank you for sharing that. That is also a common resource for different states or different communities where they do partner with their local universities for that. And a lot of the times, maybe there's like interns in the program that they have to do, you know, some internship and practicum hours. And so it'd be really cool if centers could partner up with them so they can come in and bring in those resources and presentations. So thank you for sharing that. That's another innovative way of going about a partnership to provide the IELTS skills training. Oh, Christina Lazowski also says we use them also. Are you also in Michigan, Christina? Oh, I think you did mention that before. Okay.
Gosh, I gotta get the unmute button to work for me. But yes, we use MSU extension a lot also.
Nice. And for the Texas folks on the line, since I'm from Texas, usually it's Texas A&M AgriLife Extension that does those courses. So those are the ones that I would refer to in Texas. But okay, we are coming up on the hour. I want to thank you all for joining and having a great conversation, sharing all your community resources and all the wonderful and unique things that y'all are doing specific to your center. I really hope that persons who logged in to kind of hear everyone out got something out of this and maybe great ideas that they can start using and implement at their centers. I do know this is being recorded and it will be sent out to everyone, so you'll have access to the transcript and all of that and everything that we shared. So I just want to thank everyone for joining. Thank you, Adam, Joan, Alyssa, and the April group for putting this together.
Thank you, Lydia. Thank you for facilitating it. June 19th will be our next core conversation on systems change. So I hope you all register and we'll see you then.
Bye, everyone.
Thank you.